Hello, Dr. Kim Williams. Thank you so much for doing this interview. I've got a huge amount of respect for your work, and for people watching this that aren't familiar with your work, you're the past president of the US College of Cardiology, and I want to start by talking about a quote that you said a couple of years ago that almost made you famous. It was, there are two types of cardiologists, vegans and those that haven't read the data. Can you explain this, please?
Well, if you don't mind, I'll actually give you the background because I normally don't say things that are controversial out in public. You just save it for, a good written treatise or something. But in this case, I actually was at a veggie fest, and they all promised me that they would keep it a secret, and then it was on Twitter and Facebook. But the real issue is that we do not have large-scale, long-term randomized trials. We have so much observational data that this isn't a matter of faith. This is a matter of science, that plant-based nutrition will improve outcomes. The problem is that it hasn't been studied in a way that all of the physician scientists actually prefer. And that is large randomized trials that would get published in the literature that they would read. So that really was sort of an inverted way of challenging not the cardiologists necessarily, although it did. I was actually challenging the scientists to actually do credible research, make sure that it's peer-reviewed at a high level, and get into the journals that the cardiologists would read. Why am I such a passionate about this? Because the leading death of cardiologists is still heart disease in the United States. And so what they don't know not only hurts them, hurts their family, hurts the system that they're working in when they don't show up to work after sudden death. Their patients are really, falling under this classic, let's treat the disease, let's not prevent the disease. And it's not intentional. It's an issue that the data isn't out there, it's not presented to them. And if you publish it in the American Journal of Clinical Nutrition, I'm going to find it, they're not. So we need to change that.
And you're saying they don't want to read Dr. Esselstyn's work or Dr. Ornish's work showing that you can clinically reverse heart disease?
A few of them do. And when it's not backed up by enough science to get to the point, Dean is a good friend of mine, and we've talked about this many times, and I understand his point of view about not doing prospective randomized trials large scale because there has to be a control group. Those are human lives. Those are strokes, heart attacks, premature death that wouldn't happen if they were doing his diet. So he has a hard time ethically doing a randomized trial. I understand that. On the other hand, until it gets in the guidelines, and our Institute of Medicine in the United States says that you shouldn't put things in the guideline as a class 1 recommendation, meaning you should do this. You can't make it a must for a clinician to follow this practice unless you have a randomized trial of at least 50 people in each group. And, Dean, the most famous slide with the plaque regression, where it was a lot or a little or none, that was actually 6, 7, and 6 people. And sure, it meets statistical significance, and he will defend that on a statistical basis, truthfully saying, that's the strength of the signal. And he's right. But we're caught in that conundrum of needing more science to get to the level of evidence that would be required for guidelines, which would change everything. So I can understand it. People will until we do those trials and compare ketogenic to Mediterranean to ovo-lacto-vegetarian to completely vegan, there will always be a question.
You mentioned the ketogenic diet, which is a bit of a hot topic at the moment because you've got two groups and the battle lines seem to have been drawn between the plant-based camp. There are lots of documentaries and doctors that recommend a whole food plant-based diet, and then you've got the, which is the complete opposite in many ways, the ketogenic diet, which is tends to be very low carb, and you've got lots of passionate people to argue that. How much of their message do you think holds back what you're trying to achieve and the awareness you're trying to create?
So, first of all, I like the idea, the basic concept. You change your dietary habits and you change something. That is, you can make a change. You can discipline yourself. Unfortunately, the science of it is wrong. If all you wanted was short-term weight loss, and short-term could be a year or two. If that's all you were looking for, great.
There are other markers, though, in the short term that improves, correct?
That's correct. That's right. But are any of them independent of the weight loss? Probably not. But yeah, if you lose a lot of belly fat, your insulin sensitivity improves, your blood sugar improves. There's, diabetes medicines going down the drain. It sounds and looks wonderful. There's only one slight problem, and that's cardiovascular events. If you look at mortality, so actually, I remember pulling out the slide. It's from 2007 was the first one that I saw. Well done, large randomized trial looking at the ketogenic diet and showing that it increased mortality by about 22%. And so I was talking about that, making sure everybody was hearing that. And then there was one in the Journal of American Heart Association published a few years later that isolated the people who had had a heart attack in the past, the cardiology population that we're seeing, and they were doing a ketogenic diet. It was a 53% increase in mortality. No one should be doing this. So anyway, the update from probably about 6 or 8 weeks ago was don't limit yourself to these 2 trials. Take every trial that's ever been published across the world, do a meta-analysis. I think they had 13, 16 trials in it, and averaged them all out with there was not a lot of so-called heterogeneity, so you could do a meta-analysis and have it be meaningful, and the answer was 31% increase in mortality, and for all comers. So it's not something that people should do unless your weight loss is more important than your life.
You've talked a lot about scientific data in this interview, but if you were to pick one study that would best showcase the effect of a whole food plant-based diet, what would it be?
Easy for me. I mean, with all due respect to everyone, because I should probably do some honorable mention, like Gary Fraser with the Adventist Health Studies, doing that comparison of standard American diet versus semi-vegetarian versus pesco-vegetarian, eating fish, ovo-lacto-vegetarian, which is what the Seventh-day Adventists in the United States have been pushing for years, versus vegan, and showing the differences, mostly risk factors, a little bit of mortality difference. Those are fantastic studies. You have the Regard study showing that the African-American eating pattern is absolutely deadly. You have Gary Fraser's study that said if you're black and you're a black person and you're an Adventist and you adopt one of these more healthy diets, you don't have a big problem with risk factors or mortality. And so you've got some really great stuff. But Walter Willett at Harvard has a hold of the Nurses' Health Study and the physician component of that, which is the health professionals follow-up study. When you put those 2 together, you get some fantastic information. So that entire program has produced stuff like unhealthy plant-based diets. There's a bunch of vegans eating processed food, a lot of sugar, a lot of French fries that are just terrible. They're actually worse than eating animals. Then you have the one study from that group that I quote constantly is the one that says there are no safe animal products. Because everybody wants to eat a fish or eat a chicken, instead of meat and think that they're healthy. They are better off. They're way better off. If the whole country would stop eating hot dogs and ham and start eating hamburger, the difference between red meat and processed red meat is absolutely huge. But there are no safe animal products. All of them will increase your mortality by some degree. The question is, how much is that degree? And so I give that to patients, I give it to doctors, I show it at every conference. That is, and they broke it down to cause-specific mortality, cardiovascular death, cancer death, and other, and then all of them together. The 2 biggest surprises is that dairy was not associated with cancer death. That was a surprise. The other surprise was that eggs were worse than processed red meat in cancer. And processed red meat is on the World Health Organization's carcinogen list. Class 1 carcinogen, and eggs were worse. But all of them pretty much were on the side of producing heart disease. The eggs didn't reach statistical significance, probably because so many people died of cancer and dead people don't have heart attacks. But when you added up the data, all-cause mortality, there were no safe animal products.
Earlier, you mentioned the fact that there's probably not quite enough data for institutions and governments around the world to recommend a whole food plant-based diet. But what other forces do you think are at play?
I think there's enough objectivity based on the extensive experience that we had fighting against the 2015 dietary guidelines for the United States. the story behind that is that the document came out and it said some wonderful things like Americans eat too much protein. Americans should never eat sugar. They should decrease or eliminate red meat. Said all of those very provocative things. And then what you're referring to is the industry influences that descended upon them. Now, we descended upon them as well because they were saying that they were going to remove the 300 milligram per day cholesterol limit that had been set in the previous set of guidelines. And well, it's one thing to say that, but they had two references. One was us, the American College of Cardiology, American Heart Association cholesterol prevention guidelines, and that was a complete misquote, which I can go into. But the other one was a meta-analysis where, sure, the first line of where you added up these 16 studies was that there was no impact of egg consumption 1 a week versus 7 or more. There was no impact on cardiovascular disease. Well, you had to read the rest of the abstract. But at the bottom it said, but it increases diabetes by 42%. And if you happen to be diabetic, it increases cardiovascular disease events by 69%. That's not a negative study. That's not negative. You can't use that to eliminate cholesterol. Okay, so then they did point out a limitation of our 2013 prevention guideline, which is being redone. Hopefully, I'll have my section done by the end of the month. And what that is, we do those guidelines with brackets that people don't remember. It's in the preamble that this covers the literature in that particular case from 1998 to July of 2013. And if you weren't published in that time frame, you were not reviewed. So all of the literature that said you eat cholesterol, your cholesterol goes up, which had become more controversial. People saying, okay, if you're eating 2 eggs a day, you can eat a third and a fourth egg and your cholesterol won't change. Well, that's because you saturated the receptors. I mean, that's just simple biochemistry. Well, and that's true, but it doesn't mean that there's no impact of cholesterol on of ingested cholesterol on your serum cholesterol. So that the statement in that guideline that there was no evidence that there in that time frame of ingested cholesterol changing the cholesterol was talking more about the science and what had been done in that period. It didn't say it doesn't count. It doesn't say it didn't matter. And it certainly didn't say remove the 300 milligram limit. So we ended up descending on Washington, D.C., went to the USDA, Health and Human Services, and finally got help from the Michelle Obama's food czar, Deb Eschmeyer, to try to get them what the science said. Go back before 1998. We gave them a ton of literature, and probably the best thing, because everyone in the United States respects the Institute of Medicine, they actually had a quote in 2001 in a document saying that people should eat as little cholesterol as possible. Of course, for us vegans, we say, yeah, that's zero. And so that is the quote that ended up in the guidelines. But it was a hard-fought issue. Now, getting back to what you were saying, is, we were fighting for science, but there were people who were lobbying for their own interest. So the sweetened beverage industry, the Sugar Research Foundation, the red meat industry, they all came after the guideline writers. And a lot of the things that we thought were really good about those guidelines did get taken out, or they got put in the micronutrient section. So they'll talk in the diet section about what you should eat, about lean cuts of meat and stuff like that. But they'll say, well, you really shouldn't be eating. I mean, there should be zero cholesterol. Well, you can't have zero cholesterol and be eating lean cuts of red meat.
I guess they're just trying to please everybody. I mean, we spoke earlier about the ketogenic diet. Do you think the people that recommend this way of eating, this low-carb diet, do you think these people just misinformed, or do you think there's a lack of integrity?
Oh, I wouldn't think at all that it's lack of integrity. I think it's lack of understanding that, I used to joke that, we have eyeglasses for myopia. Okay, that you've got to take a longer term view. You can't just see that, massive weight loss and declare victory. It's a little too soon. Let's see what's going to happen to the patient's cardiovascular system when they're 50, 60, 70 years old.
One thing I do want to touch on just briefly is your own personal transformation. When you adopted a more whole food, plant-based approach to eating, did you cure anything? Did you reverse or improve the symptoms of anything?
Very little. I mean, obviously the cholesterol went down, and so people will ask, well, did you feel any better? I really wasn't feeling all that bad in the first place. Am I less athletic, or did I change the slope of how, when I'm hitting with Donna, can I go corner to corner just as good? I think I can only imagine what it would have been like, 13 years later if I hadn't made that change, or 15 years. But there is one thing that I should talk about, and that is blood pressure. It's in our guidelines now because we've got enough data. Mostly Neil Barnard's group took the entire world's literature on plant-based nutrition or randomized trials and add them up, and you have a substantial effect. But it's interesting to look at the studies because the studies themselves show exactly what I see in my clinic. Some people will improve 4 or 5 millimeters of mercury when they change the diet. Some people improve 10. Some people are cured of high blood pressure. And it seems to be about a 1/3, 1/3, 1/3. So personally, as an African American, when I was eating animal products and under stress, I remember in medical school actually having a blood pressure of 140/90, which is now considered hypertension. Back then it was considered sort of borderline. But I was in medical school. I read about it. I saw sodium. Okay. The whole story of African Americans being more sodium sensitive because descended from the slave trade. I don't know if you've ever heard this story. So the slave trade, putting them in boats that are heated and very little water. And who would survive that? Who didn't die? You're genetically selecting people who can conserve sodium. And then you let them reproduce over in the United States, and you have a bunch of people who can conserve sodium, and you give them sodium and their volume expansion. Next thing you know, they have hypertension. So I cut back on my sodium intake, and my blood pressure went down to about 125, 128. When I went vegan, even though I'm getting older, my blood pressure went to 104, and that's where it stays. So that I'm really more than a believer. I'm a good example of that. Lowering your animal product intake, increasing your vegetable intake will change your blood pressure. If we could do that, it would have a massive effect in the United States because our Medicare system is scheduled to go broke in 2026, and 58% of all Medicare beneficiaries have hypertension.
And what do you say to people that know this information and agree with you, but the problem is sticking to what you recommend? It's bridging that gap between information and action. Like for me, I spend ages speaking with amazing physicians like yourself. I know the information, but I'll still go for that junk food. What do you say to the people, for example, it might be like me, or it might be people that can't give up meat and dairy?
So I have come at this from so many different viewpoints because I've listened a lot. Being more of a scientific, biochemical, you tell me, that sugar is going to hurt me, I can dump it in a second. And I have a handful of patients who are like that. Most people are not. They want to do what feels good, what they're used to doing. Particularly on the west side of Chicago, I have a very large CEO population, and then I've got inner city African Americans and Hispanics. And to tell an African American or a Hispanic to change their diet, I'm attacking them, their family, their church, everybody, their neighborhood, and you're telling them to come out of what you do and do something completely different and, isolate yourself almost. Not easy. Best thing for that is a vegan daughter. Somebody's got a vegan daughter, I got them. They will change their diet. And say, just listen to what she has to say. And that seems to make it. But that really is addressing it. So how do you get a person to change? I've really come at it. We give them a lot of information. A lot of the movies and documentaries have changed people. You get them to watch it as a family so that it's a family change. That has made a big difference. But, seeing the websites and all of the great work from Ornish and Esselstyn and all these folks, sometimes people do need to go and do an immersion somewhere and go to a wellness center if they can afford that kind of thing. A lot of our inner city patients can't do that. One of the things that I use that I'm not happy about is the transition diet. The veggie burger, veggie hot dog, veggie this, veggie that. Make an animal product out of vegetables. It's a huge industry in the United States. It's probably not that healthy. So when you look at, for example, we were thinking about saturated fat as a big negative. Turns out that Impossible Burger, which is made completely out of plants, it looks like meat, it tastes like meat. The blood is beet juice, but it looks like a bloody, chunk of hamburger. It turns out the saturated fat content of that is really right in between a Burger King Whopper and a McDonald's Big Mac.
Well, I mean, I guess they're trying to mimic and copy the taste, biochemical properties, and texture of real meat. From an environmental point of view, that's amazing. But you're saying the closer they get to that, from a health point of view, it's not very good.
I'm saying it's not optimal, and so I would people have termed that the transition diet, and I'm fine with that. If a person is overweight, diabetic, hypertensive, that's not what I want them to eat. But if they have a little less on the risk factors and they're really insistent on eating what they've been eating, then I recommend it, because I know there's not going to be TMAO, there's not going to be heme iron, there's not going to have the nitrates and nitrites. So at least I've got 4 things out of the way. Even though they are eating saturated fat, and we know that saturated fat will increase their mortality, so it's going to be a little less a little later.
You've talked a lot about data in this interview, but what do you think is more important? Scientific data and pushing on a governmental institutional level within academia or with governments, or more grassroots activism like films and what I'm trying to do with social media? And I think it'll be really interesting for you to answer this as somebody that's worked within the system.
Well, it's interesting to have me reflect on that, because I probably have a different attitude than most. This is an epidemic. In the United States, I know people in Great Britain are very familiar with World War I, being in the middle of it. Well, World War I, toward the end of it, there was the Spanish flu epidemic. And because the soldiers were sort of coming back and undeploying, it became a global epidemic, including the United States, millions of people dying. That 1918 was the last time that cardiovascular disease was not the number 1 killer of Americans. That was a long time ago, 100 years in a row. Well, with a huge ongoing epidemic, I'm going to go with full-scale attack from every direction. We should be talking about legislation to get rid of sugar-sweetened beverages, to make healthy meals in schools. We need the hospitals, and we've been doing a lot of this. American Hospital Association will look at the American Medical Association, look at a resolution that we passed saying you should feed people healthy food, okay? And they'll say, well, you're not the boss of me. But at least we put it out there that they should be making that change. We need documentaries, we need Veggie Fest, we need conferences that have medical professionals and patients. And when I get a patient, which is fairly often, that has critical coronary disease, and they've been told to take a statin that they can't tolerate for some reason, and then they start looking and they come to me, well, sure, there's great data for statins, and there's great data for the new ones, the PCSK9 inhibitor injections, but plant-based nutrition should be a part of it. And I always try to convince them to take what I've told them, take the literature that I've pointed them to, and go back to their cardiologist where they came from, because that cardiologist is more than likely going to die of heart disease if he or she does not know this and understand this. So I want all the cardiologists to understand it, then all the internists. We really struggle getting our guidelines into the hands of internists and really activating them, because primary care in the United States is a big deal. We think we're taking care of the chest pain and shortness of breath and hypertension and high cholesterol. It's really them. They're seeing 3 to 4 times more than we are. And so we need to capture those folks as well. So anything that you can do, sending data out there, getting it in front of people, YouTube, Twitter, social media, medical conferences, randomized trials, and major journals. We need everything.
Thank you for watching this interview with Dr. Kim Williams. The interview was recorded at an event by plant-based health professionals on the 1st of July 2018 at King's College Hospital. Our next event is with Dr. Joel Furman on the 27th of September, again at King's College Hospital, and Dr. Joel Furman will be talking about his nutritarian approach to preventing and reversing lifestyle diseases in his patients. Please come along.